So, so very good morning to one and all over here. So the classes of today is classification of fixed partial dentures. So we'll go for the definition. As per the definition, a restoration or replacement which is attached to by a cementing medium to a natural teeth, roots, implants. These dentures are often termed as the bridges or fixed dental processes. So usually there's a common term of the fixed dental process is called as the bridges. Okay, so that's the okay. So according to the classification, there are three types of classification. The first one is a DH Roberts. He had classified the anterior bridges based on the location. If the bridges are present in front of the canine, it's called as the anterior bridges. If the bridges are there behind the canine, it's called as the posterior bridges. So anterior bridges, they can be divided into two types. That is fixed type or fixed mobile type. Posterior bridges, again, same thing. We can divide it into two types. That is fixed type and fixed mobile type. Why there is a classification between fixed and fixed mobile is I'll be telling in the upcoming slide. Under third one is the cantilever bridges, and fourth one is the spring bridges. Fifth one is the combination of the above four are called as the compound bridges. The last one is called as the adhesive bridges. The second type of the classification by the PC Foreman, it's called as the fixed type. And the second type is a fixed mobile type. And third one is the cantilever type. And fourth one is called as the compound type. And other one is called the simple complex type. Simple 1 pontic, simple 2 pontic, complex 1 pontic, and complex 2 pontic. And the last one is called as the acid etched composite. So other type of the classification is called as the short span bridges as well as the long span bridges. So short span bridges are those bridges where the replacing tooth is 1 or 2. If it is more than 2, it's called as the long span bridges, irrespective of the location. Coming to the first one, that is called the fixed bridges. Here, the front teeth and behind the teeth, what we go the retainers are in the fixed in nature. So the automatically the pondic also in the fixed. These kind of a bridges are called the fixed bridges. As per the in the image, you can able to see that here we are replacing the molar. So first molar. So we are taking the support of the first premolar as well as the molar. So it is fixed in nature. It's called as the fixed bridges. Second one is called as the fixed mobile type of bridges. Here the front teeth, okay, it is fixed in nature. It has an extension, okay, where it can be a slot type or a dovetail shape type. Followed by once it's cemented, the remaining part will be slid over there and just cemented over there. This kind of a called as a fixed mobile type bridges. Okay, the anterior bridges, which is mobile bridges, may be used to replace either lateral, occasionally central incision. The fixed mobile bridges most commonly used for the posterior teeth. Fixed mobile bridges cannot be used for the maxillary canine and lower anterior teeth due to the difficulty of housing satisfactory dovetail. Dovetail means in the mesial aspect. Okay, sorry, the distal aspect of the front teeth having some kind of an extension is called as a dovetail. Okay. Coming to the cantilever type of bridges, the cantilever type of a bridge. Here, the front teeth we are preparing and we are cementing with a retainer along with some kind of an extension which is attached to a pontic. It's called as a cantilever bridges. But usually the bridges has one support in anterior, behind one support. In cantilever, it has only the one support. It's called as a cantilever bridges. Pontics are cantilever out of the one side of the abutment tooth and obtain support from that of one side only, indicated in anterior region where only little occlusal stress applied to pontic. Stabilization of the occlusal occlusion, like a case when lower second and third molars are missing and over eruption of the upper second molar causes dearrangement of occlusion. Indicated for replacement of upper lateral using canine as a sole abutment and upper canine by cantilever bridge coming forward from the first and second premolars. Indicated for replacement of posterior teeth in cases where tooth of one side is unsuitable as a bridge abutment. Coming to the spring bridges. Spring bridges are those bridges where we are taking the support of the posterior teeth. Here we are not taking the anterior and behind the teeth of the adjacent teeth, and we might be taking from the another area, the same quadrant. Okay, we are taking the support. Usually we are taking support of the maxilla. Okay, we don't take it support from the mandible, and it is more aesthetically pleasing because we and it can be given in the cases of some kind of a diastema also we can give. The basic principle of spring bridges is the carrying the pondic by a tooth not immediately related to it and connected to by flexible palatal bar. Indicator where aesthetic is a prime importance. Indicator where the tooth of the one side of the space is unsuitable for us abutments. Indicator where a diastema is necessary on one or both side of the pondic. This contraindicated in young patient where the clinical crowns are short and unlikely to provide adequate retention. Contraindicated when teeth on either side of the required crowning. Contraindicated when lower tooth has to be replaced. Contraindicated when shape of palate is unfavorable. Coming to the compound bridges. These compound bridges are the combination of the above what we have spoken. It can be fixed or fixed movable with along with a spring or cantilever or fixed with a fixed mobile bridges. Starting with a fixed spring bridges means imagine there is a long span FPD. Okay, here we had given the fixed. Suppose we are taken support of the center, we are replacing the lateral, taken the support of the canine, so it is fixed. Then if there is a spring kind of a extension from here, it is coming on the other side area, then it's called the fixed spring bridges in a patient wise. Then coming to the second one, fixed cantilever one is here. We are replacing the a canine. We are taking the support of the canine and the first and replacing the first premolar and taking support of the second premolar. Then if you're taking an additional cantilever to the lateral is called as a fixed cantilever. It's a long span FPD. Here we are dividing it. The third one is fixed mobile is when it comes to long span FPD, if the patient arrangement is in the different arrangement, then there are so much of load can happen, there can be fracture can happen. Not to prevent that, we are using the a mobile kind of a dentures. The last one is called as the adhesive bridges. In adhesive bridges, but here we are doing instead of the traditionally what we're doing is reducing the tooth size followed by we making the measurement and replacing it. Instead of that, we are lingual area we are as stitching is done and taking the impression and then followed by we cementing it. It's called as the adhesive bridges. There are mainly four types are there: Rochette bridges, Maryland bridges, and Virginia bridges. So the Rochette bridges, it's again the how we are doing it. That's why we have different names and all. Coming to the symbol, different types of ponding based on the location and the number of teeth. First one is simple one ponding. If a name came with the simple, then it is not involving canine. It's called as a simple. Okay. Here, simple one ponding it is bridges not involving the canine are are said to be simple. In this example, a missing central incisors and attached to the adjacent incisors as a rigid structure. Coming to the simple two ponding, here again simple means not involving canine. So anterior we can't be, we have to use the posteriors. In this example, second premolar and first molar are replaced with a bridge of rigidly attached with the first premolar and the second molar. Still here we are not using the canine as an abutment. Coming to the complex one ponding, it means we are had taken the support of the canine and replacing the lateral, or we are taken the support of central and canine and replacing the lateral. In that case also, it's a complex one ponding. Okay, complex two ponding it is. Here we are replacing the two posterior teeth, okay, or two anterior teeth, okay. Then taking the support of the canine, then it is called the complex two ponding. Okay, then coming to the last two classification, that is short span FPDs and the long span FPDs. Short span FPDs are the missing tooth is one or two is called as the short span bridges. Long span bridges are if it is more than two. Okay, occasionally we don't give that. If it is more than two, then it's called as a complex bridges. So this is all about the entire class of the classification of the fixed partial denture. Okay, again concluding, we can say It can be divided into fixed type, fixed mobile type, cantilever type, spring type, adhesive type. And based on the location, if it is involving the canine or not involving canine, then it's called as a complex kind of pitches. If it is not involving, then it's called as the simple in nature. If it is based on the number of teeth, it can be short span FPD and the long span FPD. Thank you.